So my name's Renee Ramsey. I'm a flight nurse here with Med Center Air. Been a nurse for about 6 years. Everything from med surg, hospice, but like she said, I am an emergency nurse by trade and now a flight nurse. So I want to talk to you guys today about starting peripheral IVs, intravenous catheters, however you want to call it. You'll mostly just hear somebody say, "Hey, go start me an IV." So that's what I want to talk about. Can anybody tell me without looking why you start an IV on a patient? What kind of things would
Dehydration.
Dehydration. So what would you be giving them?
0.9.
Saline.
Saline? Very good.
Yeah.
Very good.
Medications.
Medications.
Blood products.
Exactly. So fluid, electrolyte replacements. Your alcoholics will require magnesium sometimes, potassium. Medication administration. That's not just meds we give on the floor in the emergency department. You got to think if your patient's going to a CAT scan. They might need IV contrast, exactly. So blood products, and that includes platelets, red blood cells, TPN. Anybody know what TPN is?
Total
Exactly. And blood monitoring. So not so much something you're going to see on the med-surg floors, but in the ICU they will do midlines and art lines and stuff to do blood monitoring. So talking about veins and starting an IV, adults, you're looking at the hands and the arms. Can somebody tell me why you don't want to start an IV in the AC? It's where everybody loves to go.
I mean, restrict his movement. It's gonna
Restricted movement.
beep all the time.
So what kind of patients are you going to have the most problems with if you put it there?
Peds.
Peds. Who else? I'm sure you had a cranky one today on the floor.
Like
An elderly patient. They can be confused, they can be combative, and putting it there can further worsen their mental state because they're frustrated with it. So yeah, what you're going to want to do when you're looking at your veins, start low. If you go ahead and put it up here and something happens, you've completely taken that whole arm off the table. So look at your hands first and work your way up. When you're talking about your pediatric population, you have a little bit more to choose from. I know, it looks scary. You can actually start in your infants, you can start scalp veins, IVs. This is not something I recommend without talking to the parents. You'll have a very angry parent if you stick a needle in their baby's head without talking to them first. But you have your frontal vein, you also have your temporal vein. Those are good spots in infants. In toddlers and infants that aren't yet walking, you'll have the lower extremities as well that you can look towards. Whatever you do, choose to stick in an infant, make sure you're securing it. That's one of our biggest problems, especially in my field in transport. Kids are going to be all over the place, they're going to be reaching, so make sure you're taping it down really well. That being said, when you tape it, don't cover up the insertion site. You want to be able to check your IV. You want to look for redness, swelling, those kind of things. Any questions so far about where to start an IV? Pretty straightforward. They'll give you all the fancy names. You don't need to know the names. You just need to know what you're looking for in starting it, and then looking for a good vein. So, what makes a good vein? What do you look for?
Visible.
That guy right there. You know what? Funny enough, though, I would not put a tourniquet on that guy because those veins look good, but you pop a tourniquet on that and you stick it, and suddenly you've got a huge hematoma and a useless vein. But yeah,
Straight.
you do. You want them straight. You want and you'll learn to feel it as you practice more. But veins have valves in them, so you don't want to try to get your needle through a valve. It'll be really uncomfortable for your patient, and you may or may not be able to get it. So, and then non-bifurcated. That's like, if you can see it right here, it's, when your veins start to branch off, you want to make sure you're avoiding that because you're going to have a really hard time threading it.
Do you mean avoid right where it branches off,
Yeah,
or
so
avoid
like
either branch?
It branches here, but
Right.
if you come further down, just make sure and we'll look at the catheters later, but make sure your tip of the catheter isn't sitting right there at that
the branch.
bifurcation. Yeah, because that's a valve, so you'll just be pushing up against that and you'll be fighting your pump all day long. Bad veins. I know we've all seen them. You've got people who are, frequently in need of medications. They're in and out of the hospitals. They'll get scar tissue, very fibrous veins. They're very easy to see. This is not a great picture of it, but they can look like that, but they feel like rubber. You can feel them, and you know that sticking a needle through that's going to be tough. So you want to avoid those. Near bony prominences, especially in your elderly population, they'll have really tiny, they can be really tiny sometimes. Just avoid the bones. It can be painful. normal. Or if they have a site of infection or bruise, or you see some sort of injury already there, just if you can, try to avoid it. There's always extenuating circumstances, and as nurses we know we have to do what we have to do to treat our patients, but be conscientious of what's going to be accessible to you but comfortable for your patient as well. So, just some things to think about. You will have dialysis patients. They'll have shunts. Those arms, they'll tell you, are off limits. The only time you should ever be sticking a needle into a shunt is with a doctor's order or in an emergency situation. That includes like coding. That's about the only time you're going to do that. And you don't want to stick peripheral to that side as well, so just avoid that arm altogether. Cancer patients, you want to ask them. This is part of your assessment, getting to know your patients. Had they had a mastectomy? Had they had a lumpectomy? Why wouldn't you want to stick those patients in that arm? Lymphedema, exactly. So what are we going to do to make sure that we don't stick those patients in that arm?
The sign.
What?
A limb alert.
Exactly, a limb alert. So we want to make sure we're doing our job and getting to know our patients and assessing them, but that we're educating the other staff on our floor, because you're not the only ones that are going to be poking your patients. You have lab that comes, your CNAs are in there, so making sure we're doing that. And then talking about diabetics. They're a tricky population. Like I said, we do try to go for the hands and the arms. Sometimes you will have to stick in a feet in a critical situation. Your diabetics, you don't want to do that. Not only are their veins more prone to collapse on you or not be as viable, but if they do that, then their healing time isn't as well. So it'll take longer for wounds to heal if something happens with that IV site. The same applies to their upper extremity, but you gotta poke them somewhere. So just be very careful. Make sure we're monitoring our IVs and checking for signs of infection. And again, avoid your areas where you're going to be bending and moving. It may be impossible sometime, and you have to do what you have to do, but try to avoid it. Alright, so we've got our patient. We know what we're going to do. How do we prepare? Like I said, part of it is knowing your patient and doing your assessment. Second part is checking your chart. So I know you see on TV, go in, stick an IV, start medication, but you always need an order to start an IV. You have to have an order. While you're in there looking for that order, you should be looking for allergies. Why? Does anybody know?
Because of this latex and iodine allergy, because you use them on.
Exactly. Iodine or chlorhexidine, whatever your prep agent is, you want to make sure that your patient isn't allergic to it. And latex. I know that there's a lot of products that are latex free, but some still are not. So make sure we know what our patient's allergies are and we know what our product is made out of. You want to gather all of your equipment. Make sure you have it all. You do not want to have a tourniquet around somebody and a needle in your hand trying to figure out what you want to do next, okay? You want to provide privacy, whether it's in an ER and you're closing a curtain, you're on the floor, you close a door. That includes asking your patient, do you want your family member present? We assume sometimes because they're in there, they want them in there, but not always for procedures, so make sure we're asking. And you want to explain the procedure and make sure that they consent. With your pediatric patient, it is so important to, don't just talk to mom. Kids, they understand, so you want to bring it down to their level and make sure that they know what you're doing too. And you can't lie to a kid. You can't say, oh, it won't hurt, it's just a little pinch. Then you've broken all your trust and it'll be really impossible to do anything with them from then on out. So make sure we're talking to mom or dad or legal guardian, but we're also talking to our patients. Same goes for our elderly population. She may be meemaw, demented in the bed, but she deserves to have the same informed consent that everybody else does. So talk to your patients, talk to their caregivers. And then you want to place the patient in a position of comfort. This is not just a position of comfort for them, but you know, we try not to make people uncomfortable, but you've got to make sure you can access that vein. You've got to make sure that you can get to it, you can get to your supplies when you have it. So making sure that you're ready, the patient is ready, and everybody's in a position of comfort. Supplies. So a lot of facilities will have their prepackaged IV start kits. I just want to go over it with you really quick because you're not always going to have the luxury of a pre-made packet. So in it, everybody knows, you got a tourniquet, you have to have that. Find your vein. this is a chlorhexidine swab. It may be iodine, it may just be an alcohol pad, but some form of cleaning agent. We'll go over that in a minute. 2x2s, we're all gonna miss. We're all gonna make a mess sometimes. That's just how it goes. So make sure you have these. If it's your first time, I recommend getting a little bit of extra, just in case. Tegaderm, transparent dressing, however you hear it called. You wanna have one of these. And they also come with a label. Make sure we're labeling our IVs after we start them, date and time. We're really bad about that in the ER, but it's important because you can't leave that in there for days on end. It needs to be changed, it needs to be assessed. And then tape, like I said, in our elderly population, our kids, we want to make sure we're securing that IV, so you need tape. The next part is just personal preference. You can have an extension set. Makes it a little bit more accessible if you've got multiple medications going or you have a patient who's kind of all over the place. A lot of the times you'll just see the connector port. It's smaller, it can be a little bit harder to attach your medications to and make it can pinch the patient's skin. So just know your patient and whatever you're more comfortable with. Either one doesn't matter. They will say for scans, like CTs with contrast, they do like these simply because the contrast has more to travel with these. So there's the bit. And your infamous saline flush. Standard. They come in 5 mLs, they come in 10 mLs, however you want it, but you need one of these. And then your IV catheters. They come in a variety of sizes. We'll talk about them in just a second and how to choose which one that you want. But make sure you have the size that you want and one size smaller. What vein might look good for a 20 may need a 22. Oh, also, make sure if you're starting your IV for any sort of solution or medication, before you get going, prime your tubing, get your medication all set up. That way, as soon as you're done, you can just connect it right in and get going. So, IVs. You have a ton of different sizes. The bigger the number, the smaller the needle. That's the big thing to remember. So your 14 gauges are going to be, I brought an example because I think they're pretty awesome. But so this is your 14 gauge. As you can see, it's huge. We primarily use these for needle decompression, but you will see medic bring in patients with these in their arm. They're used. Well, actually, I'll let you tell me. Why would you need a catheter that big? What kind of things?
Black blood.
What kind of situation? Exactly. So what kind of patients would need a rapid infusion of blood? Trauma patients, exactly. So I think on the floors you're probably going to be staying away from your 14 gauge needles, but you will see them sometimes. Medic does like to stick them in people.
And that's the only time I've ever used them was on a trauma patient. At a trauma center.
If you want to, I will let you guys take a look at that.
Be safe.
Please don't hook yourself.
Blood is 20, right? It's like the standard is
We'll
20.
we'll
but
talk about that, and I
Okay.
actually have another slide for that. I just kind of wanted to go over not only. Wow. That was my only 14.
Katie, you're the only one that got to see it.
It's always me.
The other thing I wanted to talk about is
You want to try it?
you have catheter size, but you also have diameter and length. So you will see that your 14 gauge needle, it's 45 millimeters as opposed to a 26 or 24 that's 19. So why do you think that they're different lengths? Am I going to be able to put a 45 millimeter in length catheter into a 2-year-old?
No.
So that'll help you when you're picking your patient, or your IV for your patient. Make sure you're looking. It'll tell you the gauge and it'll tell you the length of the needle right there. So if I have a pediatric patient, I'm not going to go, well, they have great veins. Let me go grab an 18 gauge. Because I'll never get that into their veins. They're just too short. And like I said, every package has it. Make sure you're looking at it. And knowing what size needle you're grabbing. The other thing I wanted to point out to you was both of these are 18 gauge needles. They're both green. They're both packaged the same way. But what's different about them? Nope. The packaging.
Oh, the green stripes.
Stripes.
Yeah.
So look at that. I know you've all seen it. Start an IV and you hold pressure, right? Why am I holding pressure above the IV site?
So that it doesn't bleed everywhere.
Exactly. But the wonderful thing about these striped ones is they have a backflow valve in them. So when you start it, your blood won't rush out. So just be conscientious. I know that Novant and Atrium both have both products. So just know what you're getting into, what you're grabbing. So the striped one, you don't have to hold pressure. It won't bleed out on you, but the non-striped ones will. So touching on what you said a little bit more, we'll go over all this. 20 is your standard. Most patients can tolerate a 20, will have veins for a 20. And you can do most anything. You can do your rapid infusions. You can do a trauma patient with a 20 gauge. We do it all the time with Med Center Air. But also you can do all your routine blood administration and medication administration as well. Anything above a 20, 18, 16, 14, that's primarily used for your trauma patients. We don't typically like to put huge catheters in people. It's not very nice. As far as your little ones, we do like to go for 24 in your neonate population, and you will see people grab a 24 for your pediatric patient. That's not necessary. You can get a 22 into a pediatric patient, and it does the exact same thing, and it's actually better for them because, let me grab a 24 and I'll show you what I'm talking about. You were talking about the length of the catheter. When you put a 24 in a pediatric patient, that's all you have to work with. So, going back to length, 22 is slightly longer than a 24, so you just have a little bit more to work with, and it's perfectly fine for a pediatric patient.
Remember, the smaller they are, the easier they are to kink as
Yep.
well.
Yep. Good point. So yeah, just a little slide. Any questions so far about that? Alright, so now we get to the fun part, actually sticking people. This is after you've already verified your order, you've got all your supplies together, you've talked to your patient, you know what's going on. The first thing you're going to do is hand hygiene. I know people in the ER, you see us all the time, we just hand sanitize it and go in, but that's not what's best for our patient. We need to be washing our hands before and after we start an IV. After you wash your hands, you're going to put your gloves on. Do not pop the finger off your glove. It makes you look cool and like you know what you're doing, but it's not. Not only are you exposing yourself to whatever that's on the patient's skin, but you're exposing the patient. You're putting a hole in the patient, and now they've got your germs on them when you poke them. So go for a smaller size glove. You'll be able to feel it just as adequately. Just make sure your glove is tight, and you'll be able to get through it. So I hope this works. I have a video of how to... I had a video about tying a tourniquet, but I want to demonstrate it, and if I can use you as an example, that'd be perfect. Okay. Well, we're setting the mood for the tourniquet tying.
You want me to stand?
You can sit, that's perfect. If you can't see, you can move, but... So, when you're tying a tourniquet, you're going to want to go, we'll start with the AC just because everybody knows where it is, but you want to go about 3 to 4 inches above where you're going to start the IV. So you want to square it up in the back and cross it. After you cross it, take your non-dominant hand and hold it still. You don't need to move your dominant hand at all. So all you're working with is your dominant hand. You're going to pull it across and tuck it in. And it is a skill that takes a lot of practice. You're not going to get it on the first time. But what you want to make sure you do is leave this tail, and that's your quick release. So as soon as you're done, or if your patient is having any sort of paresthesias, they're telling you it hurts, it's numb, their hand's turning blue, you want to pop that tail, okay? So I want to get out some tourniquets, and I want everybody to take some time to practice, because it is a skill that takes some practice. So I'm going to leave that one with you. You too can practice with me. Save your tourniquets because you'll need to practice later, okay? Oh. If you want to do your veins,
Right?
there you go. And I'll be roaming around, so if you have questions.
Is that it?
You want to try on me?
No.
Sure. Alright, let's talk about it. Okay. Alright, so you got it? Perfect. Bring it around.
Use it to stand.
You talk like that.
Stay across. Which one's your left hand?
Yeah.
My right hand. Oh, you want your right hand. So you're gonna hold your left hand still. You want me to try? Bring it real close.
You guys can just join them.
And pull with your left. Sorry, I'm backwards because I'm not.
Actually, I shouldn't do it so tight.
Wait, hold it with your left.
You gotta go like, okay,
This is my dog. And pull it as, no, you gotta pull it tight. And if it's us, hold it like this. Here you go.
You hold with my non-dominant
Yeah.
hand.
And then now you have your right.
This is our dominant.
So it stays tight.
No.
It's good, but it's not tight
So
enough.
plant it.
Oh yeah, I know. I didn't want to hurt her.
Okay.
Oh, you gotta hurt her.
There.
Let's see what you got.
Oh, I'm sorry.
Take your jacket off. Go ahead and take your jacket off.
And then I was like, let's not see what you got.
You can do it right here.
Because this is my dog.
Are you sure?
No, that was good. Here, you
It takes a lot of practice. You'll get the technique, but bending it tight is the important part, and that just takes non-dominant.
So in order for you to
Cross.
keep it tight, pull on that one, and then you do the left.
Perfect.
But your technique needs some work. Yeah, it does. A lot.
But
that's why we're
tighter,
here,
right?
and then
Tighter.
Don't.
To make it
Oh, well, that's
Right,
nice.
so she does the exact same thing, but I like to go with that. And then pull it super tight.
Yes.
Yeah, like before
I
you
think-
Make it
So
big.
try not to cross your arms.
Just a little bit.
It's only a little tighter. Is it tight?
It's alright. You can even see the
Go
vein.
and grab my
Yep. Cross.
Like a finger.
That's my wrist right there.
It's still on that.
That's how you can actually.
She's something else.
Oh, you do?
When I cross.
Yeah, I can just like, good to go.
And that way it stays nice and tight and you're not.
You
No.
wanna go in?
Relax your arms. Tickle it on that.
It takes practice.
The vein.
It takes almost to do that. I know you were that tight, but.
No, we don't need
Here.
to.
Oh, well, there you go.
Okay, you want to do me?
You guys do it again. All three.
Okay.
Do it again. Practice, practice, practice.
Good to go. Good to go.
I'm like, why am I having such a hard time?
Anybody have any questions or want to show or?
I think it's supposed to go over the top though.
Yeah, be careful when you tuck it underneath because look at where your tail is hanging down. It's going to be all in your workspace. See what I'm saying?
The more you bend over, it'll come
Pretty
naturally.
good. Yeah, so like go ahead with the one hand.
One on one.
So you can see the tuck perfect.
Oh, I got it.
Perfect.
Oh, you did.
Nailed
Yeah, I
it.
thought it. Yeah.
Nailed it.
Freddie, don't cross your fingers.
Like swish.
Don't cross.
hands.
Not this?
Show
Which
him.
one's your dominant hand?
We'll go right behind you.
Right.
I can't.
So she said once you cross it, you just put it in your non-dominant hand.
So you've got it.
Only one more.
You got it close like this, right? And you're right-handed? So put your left hand and hold it super close to this, okay? However you feel comfortable. So you're gonna take this.
Freddie, it's not gonna bite you, honey.
Yeah, get close, get close, get close. Okay, and this you're gonna pull.
Like, I don't like undo.
And I want you to hold it like this.
Okay.
Got it? Now let go up.
Like this?
Yep, now let go with this hand.
Alright.
And tuck it. You'll work on it, getting it tighter. It takes some practice, so.
Like a tight rubber band.
So pull it. Nope. Whatever you use your dominant.
Bend.
Pull it.
Pull your dog.
Oh,
I see.
See what you do?
Yeah.
Make sense?
Okay.
Yep, perfect.
Alright, thank you.
Alright. We'll come back to that.
Very
We're gonna keep practicing.
That's great. Veins on this side.
Alright, hang on to your tourniquets because we'll use them in a little bit, guys, alright?
Good.
So, 3-4 inches above the collection
Thank
site.
you for giving me a
And just make sure you're practicing. You don't want to be that person that goes in for your first IV stick and can't tie the tourniquet the right way. So practice on each other. Okay, so you've got your tourniquet tied, your hands are clean, you found your perfect vein, you're like, this is the one I'm going to start it on. You're going to take your, whether it's an alcohol swab, chlorhexidine, iodine, and you're going to scrub for 30 seconds. And it is so tempting to scrub it and stick it. You have to let it dry. This isn't effective if it's wet. You need to let it dry. In that time, their hand may be blue, the tourniquet may be too tight. It's okay to pop your tourniquet off and let it dry. Just tie it back when it's dry, making sure that you don't touch the vein again. Okay? Okay, so now you're ready to poke. You've got a vein, you've got it all cleaned, you're gonna hold your needle at a 10 to 15 degree angle, okay? And you're, no need to go really fast, go nice and slow. So you have control of it, you're not poking all the way through the vein. And you're gonna hold it. And you're gonna insert it until you see what's called flash. You'll see blood come up into the IV chamber, and at that time, there is a little tab on the top of your IV. It's made for your finger. You're just gonna slowly advance it in, okay? And as soon as you've got it all the way to the end, you just release your safety so you don't poke you or the patient anywhere other than where you meant to, okay? At that time, if it is the striped packaging, you don't need to hold pressure, but if it's not, you need to use your other hand that you were not starting your IV with and hold pressure. And connect your RD prime tubing and flush, okay? Make sure when you're connecting, you're pulling back and you see blood. If you don't see blood, it's probably not in the right spot. And when you flush, what are some things you would look for to make sure that it's working and it's in the right spot?
It's like there's no infiltration, like it's not like
Swelling, exactly. So things you would have to document is it's not red, it's not swollen, it doesn't hurt, those kind of things, okay? And I know it's really hard to talk about this. You need to visualize it, and we'll talk about. I'll use my mannequin here in a minute, and we'll go through it before you guys get a chance to do that. Once you've gotten all that, you release your tourniquet, and you've attached your extension set. You want to, like I said, apply that dressing, and making sure we're putting a date and a time. You want to, if you use this extension set, it can hang, it can pull on things, so make sure we're curling it up and taping it down. I've seen it happen 100 times. It gets caught on the side of the bed and the patient moves and you've just lost an IV that took you 10 minutes to start. So tape this down, pick up your trash, make sure you're not leaving any needles lying around. Syringes, you don't think about it, you just throw them in the trash can. Don't. Put them in the sharps container because people are crafty and they like to use syringes, okay? And then make sure we're washing our hands and we're documenting. So without looking, what are we documenting?
Where we
how
the patient tolerated it.
Exactly. What's a big one? So you've documented your whole IV, where you put it, how they tolerated it. What do we need to be telling them that we're documenting? We always educate our patients. So we need to document that we're educating them. Do they know to tell us that it's hurting? Do they know to tell us that it's red? So make sure you're educating your patients and you're documenting that you're educating them. You also want to document the number of attempts it took you. It's okay to put, it took you 2 attempts. After 2, though, you need to be tapping out and finding a buddy. We're not here to torture our patients, even if we really, really want to get the IV. And then how well the device functions. So were we able to flush it? Are the meds infusing properly? Those kind of things. A lot of it is drop-down box. I know Epic, somebody said something about Epic earlier. It'll be a drop-down box.
Just blood
I
back.
think with Cerner, Did you get blood it's return? click yes in the boxes. But never be afraid to free text. If you don't feel like something, maybe the IV worked great, but there was a little bruising at the site. Free text it. Hey, IV infusing. Patient has no complaints, but this was noted at the site of insertion, just so you're covering yourself and you know that they know that you've assessed your patient at the site. Free text it. Hey, IV infusing. Just some pictures I put up there for you. I don't know how many of you have seen IV infiltrates, things like that, but if your veins turn red when you flush medications, that's not a good thing. Some pictures I put up there for you. You have this swelling or this redness, what you need to do is discontinue your IV, mark it, they have the skin markers, and make sure that we're documenting that it's getting better and not worse. They will tell you hot packs, cold packs, make sure you know your medication. So some medications, if you put a hot pack on and you vasodilate, you're actually going to cause more harm than good. So know your medications, and if you have a question, who's a great research? So some medications, say it loud, there you go, pharmacy. So if you ever have a question about, it's okay, IVs infiltrate, but it's our job to catch them when they do. So know your resources and treat your patient. So if you ever have a question about, just some other bruising can happen. IVs infiltrate, but it's our job to catch them. You can get phlebitis, you can inject it, you can start in an artery. It's okay. Just make sure we're taking it out and we're not inserting medications that way. I've done it, we've all done it. Just, you'll know it. When you stick it, either if you have one of these, you'll actually see the blood pulsating in the tubing, so you know it's not in the right spot. or if you have one of the smaller ones, there's just a lot of back pressure when you try to attach your syringe. Okay.
You'll actually
Take it out,
pulsating in
document,
the tube, so you
and
can
start
put
it in the right spot next time. Okay.
Or
So
if
who's
you
ready to
have one of the
practice?
smaller ones.
Yes. Alright. So I'm gonna demonstrate with my mannequin really quick, just so you know the steps. And then we've got some gummy worm jello packs and the mannequin as well, okay? So I'm gonna demonstrate with my mannequin really quick, just so you know the steps. And then we've got some managed to make gummy worm jello packs and the mannequin as well, okay? Thank you. Can you pour me? It doesn't have to be a big IV, it's just one of the IV catheters. We'll pretend all of this is together. So you're gonna wash your hands, gloves. We've educated our patient. They're comfortable with it. We're comfortable with it. We have our tourniquet. We'll pretend all of this is together. So you're gonna wash your hands and gloves. We've educated our patient. They're comfortable with it. Make sure we're doing it nice and tight. And we see our vein. I like this one. It looks great. I'm very confident. This pops. Make sure once it pops, the sponge is actually saturated. Some of them can be defective, so you won't be cleaning. It looks great. I'm very confident. 30 seconds, back and forth, back and forth. Make sure once it pops, and you let that dry. Actually saturated. Some of them can be defective. In the meantime, 30 seconds, back and forth, back and forth. While that's drying, you can be priming your IV tube and getting everything set up. You want to make sure it's all the way to the end. It's okay to make a little mess on the floor. Just make sure you clean it up so your patient doesn't trip later on it. Drying, priming your IV tube and getting everything set up. You want to make sure it's all the way clean. It's dry. We're confident now, so we get our needle. We're gonna hold it at our 10 to 15 degree angle. It's dry. We're confident now, so we get our. You won't see flash on this mannequin. There's no blood in there, but it'll become easier. You'll feel it's resistant, and then suddenly it becomes easier. At that point, you just advance with your thumb. And pop it out. Okay. That's when you do not have to hold pressure with. And you would, again, pull back and flush. After that, you pop your tourniquet. Put on your tegader chart and you're good to go. Okay? For this mannequin, I did use an 18 gauge, but try to use. You can all take turns on the mannequin, medicine or so it's fine. Everybody feel ready to try? Yeah. Alright. Awesome. Grab what you need over there. There's not enough extension sets for everybody. I just really want you to focus on tying the tourniquet properly and insert.
Yes, I made it on Monday at home.
For this mannequin, for the gummy, you can use an 18 gauge. You can use
Salt water in there. They are your worms.
Alright, perfect.
No, I don't gloves. Oh, yeah, I want to do the arms.
Told my patient what we're gonna do.
And they're okay with it?
Yes.
You feel good about it?
Yes, they're excited.
Okay.
As am I.
Just
So I'm right-handed.
I'll use this one and then I'll go.
If you don't get it, I'll
Let's see what we got.
And that's why I say good.
Karen, I have your copy.
Take some practice.
Yeah. I was trying to get out
Try
of
to
it.
get when you,
My veins are really.
so you're,
Oh, these ones are.
and if it helps,
Not.
if you don't, if you get all crossed up,
Right,
you
okay.
don't actually know what to do.
Okay.
But you'll figure out what works. That's fine.
You can practice.
Oh, really?
Get after it.
yeah.
Right there.
I feel like I keep bringing it up like too high, so it's like, here. You know what I mean?
So I
Do it again and I'll see what you're doing.
tourniquet you, I clean.
Or when you're done for so long.
Yeah.
Try flipping your hand over. Is that able? Pull. That way when you go to the pocket.
We always go bevel up.
Yeah, perfect.
Is that, or does that not matter?
Say it again, I'm sorry.
Bevel up.
Okay.
Bevel up, that's a great point. Make sure your bevel is always up.
Okay, so we have this.
So you go right here.
Did I go there?
So 10 to 15 degree angle.
Right.
Oh, she tourniqueted our worms. What?
30 seconds.
Oh, gosh. Okay, so if I feel it, then I advance it.
Yep, when it's not as hard to get through, yep, just push it through. At that point, you'll see blood in the catheter, so that's how you know.
So it'd be like that?
So then I'll hold you, then I'll put this
Without
thing in
attach?
that I have already
Flip it,
flushed.
make sure you
and
didn't go
it's
through your
okay.
gum purple. That's a good way to see.
I click this.
Yep.
Ooh, look at that.
And the goal is to do it all with one hand. You don't want to get your other hand involved in what's going on because that's how you end up accidentally doing it.
So your goal?
Yep, perfect.
Do I need to do another one? So I need to get another one.
Nice and slow, and when it gets a little bit easier, yep, there it goes. Okay.
And the mannequin's going to be a little bit harder than a real patient.
Push
Just
this
know
part?
that. Yep, just that part. And to start out with, because see how your needle's kind of following you as you do it?
Oh, yeah.
If you need to at that point, you can just go like that.
Okay.
Make sure you're not advancing your needle and going
Okay.
Perfect. And then retract your needle. Dance.
And then I just
Yep. And then you pull back. You're good. You pull back to make sure you have blood, and then flush to make sure.
So from here, pull back.
Yes.
This is already primed.
Yep. And then taper down. Just, but see how easy that wiggles?
Yeah.
So make sure when you're doing all this, you've got this hand, you're holding it all steady.
Okay. And then for removing, I'm just here. Pressure.
I recommend
Oh, I
folding it
forgot. I
over.
also didn't.
There you go.
then go a little
I also
bit
didn't
more.
hold pressure. When will we hold pressure?
Yep, so as soon as you retract your needle, you will want pressure already on it. And I say about an inch above, because if you're right here, you're not going to be able to hold it.
So ideally, I'd be like advancing here, pressure.
Don't hold pressure while you're
Yeah, but then like I
yes.
do that here and then pull the needle out. Okay.
Yep,
Okay.
make sure you're not.
And then what we're saying, fold over.
So you can perfect. And then retract your needle. Dance.
And then I just
Yep. And then you pull back. You're good. You pull back to make sure you have blood, and then flush to make sure.
So from here, pull back.
Yes.
This is already primed.
Yep. And then taper down. Just, but see how easy that wiggles?
Yeah.
So make sure when you're doing all this, you've got this hand, you're holding it all steady. Okay.
And then for removing, I'm just here. Pressure.
I recommend
Oh, I
folding it
forgot. I
over.
also didn't.
There you go.
And then go a little
I
bit
also
more.
didn't hold pressure. When will we hold pressure?
Yep, so as soon as you retract your needle, you will want pressure already on it. And I say about an inch above, because if you're right here, you're not going to be able to hold adequate
So
pressure.
ideally, I'd be like advancing here, pressure.
Don't
Like
hold pressure while you're
yeah, but then
advancing,
like
but
I
yes.
do that here and then pull the needle out. Okay.
Yep.
Okay. And then what we're saying, fold over.
So you can